I present to you Dr. Butcher.
Thank you very much for the intro, Rachel. I see in the chat that we're getting a lot of beeping. I'm also getting that, Rachel. I tried to go in my settings preferences and it wouldn't let me turn off the beeping sound when people join. I don't know if you can do that as host. So I don't know if you want to check that, but hopefully everybody's going to join. Hopefully in the next couple of minutes, and we should be not beeping at everybody.
Yeah, okay, I will check, and I'm not the most tech savvy, so if I can't, I apologize.
Okay, well that's fine. Yeah, we'll make do. I might have to turn off my mic, otherwise it's going to distract me. um, Paradise, yes, R2D2, yeah, absolutely. And I've got you can't see now. You can see there's the child. So anyway, yes, thanks very much for the intro, Rachel, and to the Health Science Student Association for allowing me to do this presentation for you guys. I am very very excited about this talk. It's one that's near and dear to my heart, and it's one that I can give basically from my experience, and there's not a lot of talks that I do that aren't research related or that aren't something relative to how to do a squat or a deadlift properly, in rehab settings, things like that. I get to talk about my own experiences. So, oh, Alyssa says she knows how to turn it off. So hopefully that works. Not hearing any more beeping anymore. So maybe it was successful. Oh, darn, there's another one. Okay. So, I guess I am going to just start sharing. So let me just pull this up here. There. So, says I am sharing. Rachel, can you just let me know if you see my front screen?
Yeah, you're good.
Awesome. Okay, so yeah, I'm going to talk about mental wellness. Oh, wait, where did I go? Something happened here. That is not what I need to show you guys. Hang on a second. I don't know what happened there. I'm going to stop my share. That was weird. I'm not going to do that again. That was, yeah, course outline. Um, You guys are all students, so you understand that, but let's try this again. I don't know why it flipped over. Okay, hopefully we're good to go now. So, yeah, so I'm going to talk about my experience. As Rachel mentioned, I'm a associate professor in the School of Rehab Science. My social media online presence is thestrengthjedi.com, and so you can find me as well as my posts about strength training and mental health and my kids. I have 5 of them. And also you'll get the odd meme that is super interesting too. So anyway, let's see if we can go forward here. There we go. All right. So the intentions for this session. First of all, why care about mental health? And hopefully you all know a bit about mental health, being health professionals in training yourselves. But I'll just give just a couple facts that I find really interesting and talk about my story. And that's really going to be the big part of it, is framing my story around how I've survived mental illness, how I've um, coped with developing mental wellness, and tried to make the move towards um, doing being a professional and looking at my mental health. I'm going to talk just a tiny little bit about finding your groove. This is a highly individual thing, but I'll tell you what my groove is and what that means. A little bit on the science and the role of mindfulness, which is one of the big aspects of my groove to find how I deal with some of my issues, and then just a little bit on other ways to promote mindfulness, not only for yourselves but also potentially for your clients, that aren't just about meditation. So, all right, so let's go. Oh, I'm annotating. How do I get out of that? I approved someone else to annotate, and now it's there. I think this should work now. There we go. Okay, so no, I don't always talk about mental health. I talk a lot about strength training. and I talk a lot about exercise, and I talk a lot about my kids. But when I do, it's to erase stigma and to educate. So there is a stigma. Let's face it, there still is a stigma about wellness, mental illness, and mental health. I think that we do need to do a better job in our world in terms of erasing that and saying that mental health is as important as physical health is, and that the two are highly related in terms of how that works. But yes, that's what I do, and I'm also trying to be fairly good with my meme game, so I'm pulling up some of that stuff. Why is mental health important right now? Well, we know that there's a whole host of mental health issues that you can potentially have. I just want to make a note so that everyone's clear. Yes, you heard correctly. I am a physical therapist. I am also a researcher, PhD. I do have training in mindfulness and meditation teaching, but I am certainly not a counselor. I am certainly not a psychological therapist. I am not a psychiatrist. I am not a social worker. These are come that my experience comes from my personal experience, and so I guess you can look at this as a patient view. Someone that's sort of an educated patient, but the patient view of what to look at here. So, the bulk of my mental health is around anxiety. And you can see that that is one of the bigger words that's listed in this diagram, but there's obviously a ton of other ones there. And by no means am I trying to suggest that my experience is the same as everyone else's experience with any of these other disorders or even with anxiety. So, but I will tell you some of the common threads and some of the things that may end up helping your patients just sort of universally. What else do we care? Well, we're in a pandemic right now, and we know that there are significant impacts, and the early research that's come out relative to COVID and the pandemic has showed that at least rates of anxiety and depression have at least doubled, and there are certainly higher rates of a lot of other mental illnesses and challenges with mental wellness. That are going on because of that. There's a lot of other things in the world going on as well, and a lot of these issues relative to how lives matter, Indigenous lives matter, Black lives matter, person of color lives matter. Not to be exclusive of anyone else, but certainly there's a big prevalence of looking at some of the challenges that we have in our world. I wanted to put a political slide in here, but I typically don't talk about politics. But you can look at some of the issues around even the Canadian, but the American political situation right now, and looking at how some of that stress can come. And I often worry about when we're going to get nuked by our neighbors to the south, and I'm hoping it's not soon. Hopefully, there's a good outcome to the election coming up. But anyway, so there are lots of reasons to be feeling extra stress, right? Extra. It doesn't even have to be a diagnosed thing. It doesn't have to be an actual clinically diagnosed concern where you can have these extra issues, particularly around anxiety and depression being two of the very, very common ones that are associated with some of these life things that we're dealing with. Plus, now you guys are dealing with having to do remote classes, going through health professional training primarily remotely, and then when you come in to do your labs, it's it's a very stressful, serious situation. And so there's a huge reason that we might be concerned with this stuff. um, I'm just going to just spout out a couple stats here on mental illness, and this is something that is, even without the pandemic and everything else going on, this is sort of the normal situation. And obviously, we're way, way above that. But just a couple facts and some stats from the Center for Addictions and Mental Health in Canada. In any given year, 1 in 5 Canadians will experience mental illness. So look at the 200 plus people, which is amazing, by the way, 200 people plus coming into this talk. So good on you guys for coming out. But out of the 200, there's a significant portion of you guys that probably have some sort of mental illness or addiction problem. By the time Canadians reach my age and a bit older, 40 years of age, 1 in 2, so this is half of people have had a mental illness or at least some sort of mental health concern. 70% of mental health problems have their onset during childhood or adolescent, and people aged 15 to 24, I bet you guys are kind of around the top end of that, are more likely to experience mental illness or substance abuse disorders than any other age group. Like this is important stuff for you guys with all the stress that you're undergoing, plus the regular life situations. Mental and physical health are linked, and this is where I've actually changed a lot of my research from purely looking at the physical and functional and physiological changes that happen with different types of exercise training to look at the psychological side of things, and to look at how mental health and promoting what could be called mental robustness, mental capacity, not in terms of intelligence, but in terms of emotional capacity, um, and how those are linked with physical health. And it's well known that people with long-term medical conditions like chronic pain are also more likely to experience mood disorders. And conversely, people with different types of mood disorders are at a much higher risk of developing a long-term medical condition. And we see that a lot in physical therapy relative to pain responses and mental health issues. A couple other things. Huge stigma, right? It's not something that even now a lot of people feel comfortable talking about. But interesting stats from a couple years ago. Only 50% of Canadians say that they would tell friends or coworkers that they have a family member with a mental illness. And that's compared to 72% who would discuss cancer and 68% who would talk about diabetes. This is not something that people really want to talk about. 42% of Canadians were unsure if they would socialize with a friend who has a mental illness. Wow. To me, that's shocking. It really just goes to show that that stigma is really still there. 55% said they would be unlikely to enter into a spousal relationship with someone who has a mental illness. Wow. So that's good thing I'm already married. My wife also understands very well what
Can walk through is
our
that kind of
concerns and that. Big one here. Um, 46% of Canadian thought people use the term mental illness as an excuse for bad behavior. And then 27% said they would be fearful of being around someone who suffers from a serious mental illness. Again, that is super, super scary, and just really goes to show that this is something that not only if you have a lot of you will have dealt with this in terms of your personal lives, but even as professionals, you're going to be seeing a really high number of clients that are going to be able to have this. So I did see a hand raised, and just make sure you guys are putting your comments in there. And if there's something that can wait to the end, then we'll do questions at the end. But as Rachel mentioned, if it's something that's like super important for clarification, then absolutely type it in, and then Rachel will interrupt me. Otherwise, I'm going to continue. Okay. This is sort of the typical thing, like, when you suffer from depression, just cheer up, just be happy. Yeah, it's not like that. It doesn't work that way. So this is something that you do have to um, take more responsibility for the way that you talk to individuals, and I certainly found that being the case with close friends and family over the years, that there's a lot of education that's needed because people don't understand. It's not like having a broken foot where you're wearing an air cast, or you're wearing you have some sort of physical issue that people can see and go, oh man, it's terrible that you broke your foot, which I actually did last week. It's terrible that you broke your foot. How are you feeling? Are things okay? Have you seen a doctor? You gone for x-rays? Like, that's the type of conversation we have with physical illnesses. When it comes to mental illnesses, nobody wants to talk about it. It's not like, because you can't see it, right? You don't know. And so you see someone who's seeming depressed, or maybe they're having some issues, or they're withdrawing from situations. It's like, come on, suck it up, you can do this, right? Like, that's the typical response that we tend to see. Thankfully, the education system is changing, that we're getting through that a bit better, but certainly not in every case. And it is obviously, with those stats that I've shown you before, it is a very, very high prevalence that we see that stigma. Um, Now compound that, and not to say that there's any more importance to men's mental health at all, because there isn't. Men's and women's mental health is just as important, but the stigma around mental health for men, it's the number of times that with my anxiety over the years that I've had somebody close to me saying, "Yeah, just suck it up," or like, "Why are you worrying about that? It's okay." Kind of thing. And it's like, be a man, or whatever they're going to end up saying, and then you end up drowning, right? Because you don't have the supports you need. So we do need to end the stigma, and that's one of the reasons that I come on and do talks like this. So um hopefully my meme game is working here. There's a lot of potential here for mental health issues, being a fire in the background. Tree looks like it's exploding and falling out of the ground, and then me just making fun of it, going like, haha, yeah, then me being anxious and withdrawing. Yeah, I'm just an introvert. Just don't mind me, ignore me over here, and talk about my imaginary audience, and make jokes about myself. And then there's the more common one that, yep, this is fine. There's fire going all around me, but I'm pretending that everything's fine. So this is the situation that we are told is supposed to be normal about having these mental health issues, but we know very concretely that that isn't the case when we actually start dealing with individuals that have these conditions. And as healthcare professionals, we certainly can't take that attitude towards not only your clients, but this is also about you guys too, right? This is about your situation and about your anxiety or your whatever struggles that you have at the moment, that we can't just assume they're fine. So, in terms of steps to recovery, health and stability emotionally, one way you could look at this is an icy set of stairs. Like, it's going to be pretty darn hard to get up this set of stairs, and you need to have some strategies and things that can help you navigate this. Because I can tell you, having a good 30-ish years of struggling with mental issues and mental wellness, that a lot of times life, just even to get out of bed or to attend classes that you're teaching, or meetings, or just to go to the grocery store, sometimes life looks like this. And to understand why that is for you and what you can do about it is really important. And the sooner you do that, the better. But I'll give you a sense of my journey kind of coming up here as we go. So here is the yin yang that I know most of you are probably familiar with, but it's expressed in terms of the good and the evil of Star Wars. And if you didn't guess by my background and of course my social media moniker of the Strength Jedi, it's Star Wars is a pretty big part of my existence and my life, and I really relate to a lot of things here. So um, but what I want to do, just to frame up where this comes from, is just give you a little bit more of my story. So I've told you that my clinical diagnosis is generalized anxiety, or I said anxiety, but it's generalized anxiety with some social and performance anxiety mixed in. Have had bouts of depression in my life. I wouldn't say I struggle with depression at this point in time in my life, but I certainly still am dealing with my anxiety, and I don't expect that to go away. And that's one of the big revelations that I had in dealing with this for myself, is that it's always going to be there. It's the anxiety that I have is always going to be present, and it's just my coping strategies and my ability to deal with it have certainly shrunk it down. And there's a nice meme later on that I'll show you exactly kind of what it looks like and feels like for me. But it started back when I was in physiotherapy school. And I had all the same stresses that you guys have in terms of your sort of health professional education. Certainly wasn't in a pandemic. We weren't doing online. We barely had the internet at this point. Oof, ugh, I just dated myself. Sorry about that. But anyway, I did have a lot of those issues. And then for me, and this is certainly not to say that my situation is better or different, but for me was around it started around having a fairly severe concussion. And we do know that there's a link between mental health and brain trauma, and so that's one of the initiating factors for me. But I've dealt with fairly severe anxiety since then. um, I didn't know it at the time, though. You might think, oh, well, diagnosed with anxiety, you're going to see somebody about it. Well, I'll tell you, I didn't. I went to my family doctor after I realized that maybe I can't quite cope with things, and I thought it was depression at the time. Got on some meds, maybe helped a little bit, but certainly wasn't under any degree that I would say I was in control of the situation. So I went through physio school, work as a physiotherapist in private practice, a master's degree, further work in private practice, and in pulmonary rehab. I spent some time in. Then I went and did my PhD, and then worked as a faculty member, all the while not getting diagnosed with anxiety. And I've had some fairly severe bouts in that time frame. So you can imagine I'm the typical, like you don't talk about it, don't bring it up, don't talk about it. But I'll tell you the number of times that I was not in control of my mental wellness to the degree where I was not going to work. Sometimes I would call in sick significantly, and I feel really bad for my employers because they were like, oh, come on, you're kind of sick a lot. Well, it's because I had the fear that's associated with the anxiety to even just get out of the house to go see clients, right? Which was in a job that I love, in a situation that I love. So it's very easy to fall into the trap of I don't even know what's going on, right? Well, I'm on meds, shouldn't I be better? And that kind of thing. Those thoughts were going through my head, but we're talking 20 years ish of me going through that. Now you can still be obviously successful, and that was the point that I wanted to make. That I still was able to get through my health professional training. I was able to do grad work. I was able to work as a clinician, sort of, and then come on as a professor here at the university. And I it wasn't until I actually, it was sort of when the poop hits the fan. I'll say it, the shit hits the fan. Sorry about that. I apologize if you guys are adverse to some language, but there's really no other way to describe it. And I had a bout of fairly severe anxiety attacks, panic attacks within the course of about a week. Really hit rock bottom at that point. I was teaching and doing research at the time. Hit rock bottom. Was canceling classes. Couldn't get out of. Was really having trouble even getting the strength or the will to. Sometimes it's motivation and will just even to get out of bed, and it's very disabling. It's very crippling. Had I known then what I know now, it certainly would have been a situation where I would have had to go on disability to a certain degree because I didn't have it under control. So you're going to see people like this a lot. People that are fairly high functioning, able to kind of look like they're normal, and they might even be the happiest looking people. They might be the people that are putting on the masks that are the ones that are super happy, and you wonder, wow, this person couldn't have a mental illness. Yeah, remember, by the age of 40, half will. Okay, so this is significant, and you're going to see it a lot. So what happened? Well, of course, at that point, panic attacks. Actually, I thought they were heart attacks, to be honest, at the time, because that's what it feels like sometimes. And went through a bunch of tests and actually started to talk to someone. So saw a counselor, saw a therapist, went for a short period of time in the psychiatry realm. Didn't turn out that I needed that. And really the biggest thing was finding out what exactly was going on, because all of this entire time, not once did I think I have a mental disorder or I have mental illness. Like you can kind of, you hear me, you're probably like, what? How could that be? Sitting back there in front of your monitors and going like, I don't know, like, is this guy dumb? Like, how do you not know? I can tell you, you don't, right? Because partially you don't see it. Partially it's the stigma of not talking about it and not understanding how these physical symptoms that you get with mental wellness concerns, the physical symptoms you think are other things, right? So that link between the mental wellness and the physical wellness is huge. So okay, so what then happened? Well, I went through that process. I discovered that I was what I would say emotionally dysregulated. It had a lot to do with my autonomic nervous system. So getting into something that I could actually relate to as a health professional, go, oh, well, yeah, I know about the vagus nerve, and oh yeah, I know about sympathetic nervous system and how that all plays in with stress responses and things like that. And I started to be able to frame it around that, and recognized that I had an emotional dysregulation that affected my autonomic nervous systems. And a lot of the symptoms that you get can be attributed down to that. Not to say that that's everything, and of course there are other things there as well. Um, but the impact for me was around awareness of what was going on. And so I'm going to talk about awareness coming up here right away. All right, so let's move on here. Taking care. How do you take care of your mental health? Well, talk about your feelings. Keep active. I agree with those two. Um, Make a meme that has a grammar error, eating and potato. Obviously there's lots of other ones that are that this is obviously a bit of a joke here, but certainly talking about your feelings and keeping active can be two really big finding your groove moments. And for me, my groove is around a certain type of activity, but it's also around being able to discuss what's going on and why, and to understand exactly what's happening. So for me, the process was around mindfulness and the fact that I was really completely disconnected. I had if you sort of think of that your mind and body are connected, and a lot of the responses that you get autonomically are related to how you deal with certain stressors. Mindfulness is the really it's the way that you can connect yourself or reconnect yourself. I was living a very mindless, or in some situations bodiless life, and I needed to discover, and I did discover, mindfulness, and what is sort of its sister term is bodyfulness, which is really, again, both of those connection of the mind and the body. um, John Kabat-Zinn is I believe he was a chemist or a physicist to begin with, but he is sort of the researcher that is the Western father of mindfulness. Now, mindfulness is not something that originated in the Western world. Particularly in the late 70s, this is something that goes back, centuries, if not millennia. Usually Eastern countries, and particularly India, where you saw a lot of the meditative practices come from a lot of the practices that were common. But it's John Kabat-Zinn who brought a lot of that into the mainstream Western world by producing research using Western means that showed that there was a benefit. And so he's defined mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And it seems very, very simple. If you would have asked me back when I first started having my issues, this is the type of thing that's going to help you, I probably would have laughed and said that just seems kind of hocus pocus to me. But the reality here is that this purpose and spending time doing this has been linked with many, and I'm not just talking about a couple studies here and there. I'm talking about many different changes over multiple studies that have actually shown how much change you can actually get in your anatomy and your physiology. And so I'll just briefly go through some of that a bit later. One thing to keep in mind, because a lot of people think meditation and mindfulness are the same, they're not. And this is a really important concept because not everybody likes to meditate. I certainly do, but it's not the only thing that I do to manage my mental health. But mindfulness has helped me a lot, or meditation has helped me a lot. But it's the mindfulness in other situations that has also helped. So you can do meditation to be more mindful, absolutely, and that's probably one of the cornerstone formal practices that you'll see. But there's lots of other ways to be mindful. You can be mindful with general movement, with walking. You can find eating or other moments in life. Hand washing is a really good one for healthcare professionals and students. Finding these moments where you actually just tune into what you're really actually feeling, and that sort of that doesn't have to be meditation. But then there's also other things that are related to meditation that aren't mindfulness, like the ones that I've got there, and they all have their potential benefits. But just to give you a sense that we're not just talking about meditation, there are other things here too. Okay, so just very, very briefly, because you all either have taken this or will take some of this aspect, but we do know that a lot of the aspects around mindfulness relate to stress, trauma, and reactivity. And we know that the normal response to stress, if you have what they term a regulated, emotionally regulated autonomic nervous system, you have a reaction that relates to a positive outcome and relays then to a positive outcome. But in the presence or the in the presence of something immediate that's trauma induced, or that you've had trauma in the past and you might have a trigger that induces the specific response, you have what they term a dysregulated system. So a dysregulated emotional autonomic link, which relates to a dysfunctional reaction and potentially a less positive outcome. And so a lot of what we're trying to do is to recognize the trauma and to try and deal with, well, how do we re-regulate? What is the process that we go about to re-regulate? And we think often trauma is abuse, or it's some sort of loss or grief, an injury, illness. We deal a lot in medical professions. Those are very common uses of the term trauma. But then there's other ones like chronic stress. We can see violence in someone's life, disasters that happen, pandemics, right, could be considered trauma. But for a lot of us, even without all of those things, you can still consider chronic stress to be trauma. And this is where, in our daily lives, we are dealing with a lot of stresses. And we know that stress comes with a certain response, right? You have certain stressors, like let's say evolutionary, we were being chased by a bear, or we are being chased by some sort of other predator. And our stress response was to fight, flight, or freeze, right? So we're trying to save our life, right, by having these stress responses. This is the activation of the sympathetic nervous system to get the type of responses that are going to save us and save our lives, right? Well, we don't typically get chased by predators, or we don't get chased by bears. The bears and the predators of today's life are much more along the lines of money or time or assignments in class, or I've got an exam, or my boyfriend, girlfriend just broke up with me, or, whatever it happens to be. It's the day-to-day things that we get caught up on, and we have this chronic stress response that just is like sympathetic all the time, right? Nobody can live in a situation where you're sympathetic all the time. And I'm going to tell you a little bit about what happens with that. So, if you're familiar with a lot of the psychology of optimal performance and arousal, you've probably seen this curve before, the inverted U, where we know that if you're in the low end of attention and interest or arousal, that you won't be ready to perform optimally. Right? You won't be ready to chase the bear. You won't be ready to or to run away from the bear, or to fight the predator, whatever it happens to be. But if you're also too hyped up and you're over aroused and you have incredibly high anxiety, your performance is going to reduce as well. So somewhere in the middle there, your middle ground is where your optimal performance would be. And that's, in the evolutionary world, that's where you fight the bear or run away. So we see periods in a healthy nervous system where we bounce between sympathetic and parasympathetic situations. So you get chased by the bear, and then you get away and you settle down, you relax, right? You do some exercise, and then you can calm down, right? Or you have some certain sort of stress, and then you're able to calm down after that. Normally, we see that we have a normal range here, or a normal window that we can kind of stay within, where we go from more sympathetic to more parasympathetic. And that's a normal situation. That's part of what we're supposed to do, right? We're supposed to run away from the bear and then settle down when we can, right? Like I said before, there's a lot of situations where we find ourselves not able to do that. And so this particular graph just shows you, this one is me to a T. And I know not everybody's going to be like this, but for me, what I find, my traumatic event is just my anxiety, right? It's the stresses of life and maybe brought on by my TBI early in life, but maybe not. But I never used to in all of those years of me trying to be high performing while dealing with this, I wouldn't have this normal flow that you see here. I would have the red line. I would red line it up to stuck on, right? So my sympathetic system would go into overdrive. I would feel panic, anxiety. I'd be hyperactive. I couldn't relax, hyper vigilant, flooding of emotions, sleeplessness, chronic pain. Sometimes it's hostility and rage. Why the hell did that professor give me that assignment? I can't do it. Right. And then you'd pull the all nighter or two all nighters in a row, to try and deal with that. And the problem is you get stuck on and you don't know how to come back into the normal range. So what happens? Eventually you crash, right? So eventually you get stuck on and then you get stuck on off. And so this is so exhausting that eventually you then fall into this stuck on off situation where you're depressed, lethargy, you have sort of a deadness feeling, chronic fatigue, disorientation, painful sometimes. Things that are painful become more painful, low blood pressure, poor digestion, all sorts of situations that is sort of stuck in this parasympathetic state that you can't really get out of. And it's not a relaxed state. It's certainly a very not healthy state. So I found myself bouncing between stuck on and stuck on off, and I could never really find that middle zone. So this is one way of looking at it, and just for the sake of time, I'm not going to spend a lot of time on this. But Porges' view of the autonomic nervous system talks about the different systems, and that actually we tend to think of the sympathetic system as fight, flight, freeze, and then our parasympathetic system, excuse me, is one where you can relax, but it's not necessarily true, right? You also have this life threat situation where you have the dorsal vagal pathway that can kind of be in combination with with the sympathetic nervous system to really deal with some of these life threats. But then your safety is ventral vagal pathway, which is more of the parasympathetic system where you're relaxed and regulated. But you can read more about that, or I can provide some resources for you about that. What I've done is I've taken my view and I've turned it into, of course, a Star Wars type reference. So this is the good and the bad of Star Wars, red being the Sith or the bad side, and the blue being the Jedi or the good side. And, we can look at this as having optimal performance happening in this number 2 challenge zone, and then good comfort, calm, relaxation in the 1 zone. So in an ideal world, this is a situation where we bounce between 1 and 2, sympathetic, parasympathetic from 2 to 1, 1 to 2, and can actually be in control of our emotions, be in control of our situation. But very often, if you can't regulate well, you fall into either this 3 or 4 or some combination here. So I really realized, those outside of the windows when I was stuck on, that's the overwhelm where I felt uncontrolled, hyper focused and driven. But this is what allowed me to do the all-nighters to actually be productive in my life. But it wasn't healthy. It wasn't really productive for a long period of time. It results in sticky thinking, disrupted thinking, agitation, and reactivity. And then once you tire out of that, then you can fall into withdrawal. And this is where what I would do is any of the stresses that I would have where I'd be overwhelmed, this is where I'm like, nope, not getting out of bed. So what do? You go on your phone, you play a game, whatever it is, you tune the world out. Not a healthy way to recharge, right? So trying to deal with these blues and reds and trying to go from the 3 or 4 into the 1 or 2 is one of the biggest challenge that I've learned that most people need to do, and it's certainly what helped me. So how do you do this? Well, for me, it's trying to move in the direction of the arrows, being able to increase my level of arousal and energy by staying in the 2 and the 1 zone, but being able to regulate my autonomic nervous system. And you go, okay, well, how do you regulate your autonomic nervous system? Well, the research is actually very clear about how you do this. Okay, so if you're talking about a good situation, or the situation where most people can deal with things more comprehensively, it's with this regulated situation. But when you're unregulated, this is where a lot of the problems come from. So the difference is finding your alligator or what it is for you. What is your groove? What is the thing for you? For this guy, well, it's an alligator. Our associate dean always talks about the close alligators and the far alligators. Well, this guy's a good close alligator. He's not going to bite you, but interesting sort of situation. But for me, it was about awareness. And it's the awareness that comes through mindfulness that really helped me. And I've really related that to the force. And I have all these nerdy, geeky internal debates with myself about how mindfulness is similar to the force and that. But realistically, what we're talking about is being mindful, paying attention with intention or on purpose and non-judgmentally, and that is what helps keep you into this number 2 zone and then being able to relax down into the number 1. Okay. So this is really to a T what I had felt 10 years ago. It's like, oh my God, what the heck is going on? Not even knowing that this creature that's labeled mental illness, I had no idea that it was even mental illness, right? Now I'm aware. I have that awareness. I understand what's happening to me because I've talked with people and I've gone to counseling and I've done this work. That I'm like, yeah, I recognize. Yep, sure. My mental illness, my anxiety that I feel. It's like, oh yeah, there you are. You're there. You're cool. Okay, I'll let you go. It's fine. Right. And then be able to carry on with my life. And it takes a lot of work to be able to go from one to the other, but it's super important for people to recognize that you can and that you can do so by seeing the professionals that you need to see. Right. So what is it for me? What is the steps to health and stability and recovery? Well, it's boot it up. And I won't say the last word, but for me to get up these stairs, it's like a good set of boots. That's for me the physical aspect, it's the training. And then for me, the mental training, the work that I've done in meditation and mindfulness, that it's really been these extra chains and spurs on the boots to help me get up the set of stairs. So really what I've been doing is putting awareness into this situation. And so those that deal with and have done a lot of work in mindfulness understand that we're taking awareness into this stress response and putting it, understanding your stress, being aware of it, putting your, finding the regulation side of it, the reaction side, being aware of your reactions, being aware of the outcomes and such. So I recognize I only have 2 minutes left, so I am going to try and go through this very quickly, but there's some important things to look at here. So mindfulness research, this is, up to 2018. Obviously, back when I did my training in 1998, mindfulness was not a thing. 5 publications in that particular year that mention it. But we get up to 2018 and we're, this is per year, by the way, this isn't the total number. We're looking at, over 800 publications, and I would venture to say that we're probably pushing at least 1,000 a year now. There's just a lot more, including some of the work that I'm doing. What does the research say? Behavioral and physiological changes that are very, very concrete, that we know that actually happens. So obviously there's a significant relationship between the behavioral as well as the physiological, but these are actual changes that happen. We know that mindfulness increases academic performance. Well, light bulbs, ding, 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 right? This is something that you're probably going to want to pay attention to. It affects the stress responses, depression, anxiety, resilience, cardiovascular health, insomnia, chronic pain. And a lot of the reasons for that are these physiological changes that we actually see that have been shown. We see morphology of the brain change. We see, a lower stress response. We see that in the areas that light up with stress and relaxation. We see stress hormones and proteins change. We see the autonomic nervous system markers change, heart rate, breath control, cortisol, that sort of thing. And this is just one example from the brain perspective of all of the different brain changes that you would potentially see that have been shown due to mindfulness and mindfulness meditation. We're talking a significant number here. I won't go through this in detail, but if you want, I can provide you with a study here. But this is a really nice graph that talks about how doing attention and awareness training through meditation in this example has an impact on stress responses, both psychological and physiological, mental filters, but then relate to telomere biology. And if you know what a telomere is, it's about aging and aging well. So, this is something that can have a significant impact. Other clinical benefits, balance in the elderly has been shown to be enhanced with mindfulness. a really interesting study on wound healing, and this is, of course, the child or baby Yoda doing his healing. Acceptance and adherence to exercise programs, mind muscle connection and recovery and strength training is where my research is going. But building resilience is another part of it. And this slide that I'm about to show you is the first time anybody's seen this. So I did a study, just completed the quantitative part of this, where we did a survey of over 130 older adults over 50 plus that are strength trained, that have been involved in strength training programs. And we looked at the link between resilience and mindfulness. And you can see that the higher the level of mindfulness, the higher the resilience. And because mindfulness was the highest predictor of resilience, we broke people into high and low mindfulness groups, and we found significant impact on, of course, if you have high mindfulness, you have better resilience. The SF36 has shown, there's several markers in the SF36 that have shown to be improved, as well as self-efficacy had the tendency to be a bit better in the high mindful group. But really interesting preliminary work to see that there really is a link between resilience and mindfulness. So how do you be mindful? Lots of different ways. One way is meditation and deep breathing, right? We know that taking deep breaths can help you regulate your system along with awareness. But often it's not, as I said before, not about meditation necessarily. It's about being present, being in the present moment. Um, Saying, well, let's not worry about the past. Let's go, not worry about the future. Let's actually spend our time in the present. And how do you do that? Well, lots of different ways you can do that: through eating a bar of chocolate. Take 30 minutes to eat a bar of chocolate and do it. If you're like me, it's like you're done that bar of chocolate within seconds, not minutes, right? But maybe take the time to really feel what you're feeling, taste what you're tasting, see what you're seeing, pay attention to the situation around you, feel the sensations it gives you. You can do that while washing your dishes, or again, if you're going into clinical placements, washing your hands between clients. That would be a really good way of doing that. Doing laundry, you can be mindful. Cooking, all sorts of other things, taking a walk, active movement, even on the toilet. This is my good friend Shelley Prosco, who I graduated with at this university from the physio degree. She has a toilet meditation, amongst all other things, that talks about being mindful while you're doing your business. Really nice way to look at this, and you can see her work there. But I think, I'm a few minutes over. I apologize for that. Hopefully I've left enough time for questions. I did end up rushing a little bit through the end, so if people do want more information than I was able to provide through the course of some of these last slides, I certainly have all of the references that from all of the different studies that I mentioned, and all of the different types of responses that you'd end up seeing. So I can, if anybody wants those, I can provide you with some of those. So anyway, thank you very much for your attention, everyone, and I'm sure there's probably some questions. So Rachel, I'll maybe turn it back to you for those.
Perfect. Yeah. Thank you so much, Dr. Butcher, and for raising that awareness of how you can have a mental illness and still be highly functioning and very successful. So that was just a really good point. I know for me to realize that. We have some questions coming in, I think. The first question is, how did you deal with the realization that you would have to make managing your mental health a lifelong priority and not viewing it as a disability?
Great question. You know what? I never looked at it as a disability. I could have. I think, I mean, that was just me in terms of my personal situation, is that I never really looked at it as this was something that was going to disable me for my life. I've recognized that I had a significant amount of success, and that I could look back to my past and see what were the moments where I had more success over others. And and I recognized, and for me, it was my initiation into this mindfulness world was through taking a mindfulness-based stress reduction course, a formal 8-week course of mindfulness. And it was the education behind that, and how I really, it's had that 4-quadrant graph that I showed you, was like, oh, I know. And I started to be able to realize, I could tell you right away, am I in a 4? Am I in a 3? Am I in a 2 or a 1? Where am I? And recognizing that by just spending a little bit of time, and the research, like you can do meditation for, I mean, obviously the more you do it, the more change you're going to get. But this mindfulness can be 10 minutes at a time. Like if I don't have time during the day to meditate, that's fine. All I need to do is take like 5 minutes, and or even sometimes it's 10 seconds to pull me from a 3 into a 2, or a 3 into a 1, or from a 4 into a 1. 10 seconds of taking a couple deep breaths. I, call it centering myself or bringing myself to where I can see my anxiety, and then I let it go. And so it's, for some people it's a lot harder than that, and for some people it's probably easier than that. So I guess to answer your question is that, don't look at it as a disability. Let's look at it. I mean, yes, it is, and it's okay to see it that way, but say, you know what, you can actually develop the skills to get beyond it. And I guess that would be my advice.
Awesome. Thank you. Next question is, can you just talk a little bit more about the link between exercise and mental health?
Great. So I didn't put any slides in there, and I guess I was going to talk about what my groove was, and I never really got there just because I was rushing a bit at the end. My groove is around strength training, and of course, as Rachel mentioned, I'm a semi-competitive power lifter. I love training, but I go through periods where I don't train, and part of that's because of the anxiety. And but we do know that countless studies, not just on strength training, but any activity or exercise, aerobic or anything else, has a very significant impact on coping mechanisms. It has an impact on cognition. It has an impact on reducing depression, anxiety symptoms. So there's very much, if you look at the physical world, can have a very big impact on what happens mentally or psychologically. But I also think that there's the reverse, in that the more mentally you can build your mental robustness, or your resilience is what I'm kind of terming that right now. It might not be exactly correct. The more you build that, the better you can cope with things that happen. Like I said, I actually broke my foot the other day. I could have been like, down and depressed that I have to wear a boot, and I'm not going to be able to train for 6 weeks at least, in terms of at least that leg. And but I think that if you really take the mindset of this is part of the process, you can kind of get over those things quickly, and it allows you to become more physical and do more physical activities. Sort of opens up some freedom, that prevents a lot of what I was feeling, which was inertia. I always described it, my anxiety, as inertia. It's like, I'm sitting here and I feel like I just can't get out of that. I can't move. Something's holding me back, right? And once I realized how to do that, then I realized that, oh, okay, well, if I can help myself mentally and psychologically, that's going to help me do the things that I love to do in life, right? So yeah, I do think it goes both ways.
Perfect. All right. We're going to jump back to mindfulness now. Is it better to be mindful in silence and pay more attention to our thoughts in the moment, or can listening to music or playing background music help?
Depends on the person. So I know lots of people that I've talked to that love music. I mean, I love music too, but I mean, love to meditate with music, or to become mindful with music. Sometimes silence. One thing that I've discovered for myself is I love listening to sound, but that sound can't be verbal. It can't be something that actually has words. So if I'm being mindful, I can't have like a song playing and someone singing, but I can play classical. But for for me, it's actually not classical music. I don't like classical. I listen to movie soundtracks. So what helps me go is like Star Wars, right? Like it's also the emotional link that I get to that. So that's me. I also like background noise, like sounds of water for me are particularly strong and powerful. Some people love silence, and some people love to be mindful in silence. I just find that I feel a better benefit myself, but it is completely individual and personal. So it's whatever allows you to be mindful of the situation, be aware, and let go. And that's what it is. Meditating and mindfulness is not about removing thought or removing feelings. It's being aware of what's there, and then just accepting it. and saying, okay, cool, I had that thought, right? Okay, let's come back to whatever your center is or whatever your focus is. For me, it's usually breathing. And so, just come back to my breathing and focus on my breathing. Oh, I had another thought, come back, right? So for me, water and sort of nonverbal music, non-vocal music is what does it. But I know lots of people that have lots of different situations. So experiment is what I would say, is experiment with it and see what works best for you.
Right. Next one. Apart from mindfulness, do you have any other suggestions for being able to do well in school and not fall behind or lose motivation while dealing with anxiety and depression?
Good question. So for me, I mean, now it's a lot of mindfulness. For me, I'll be honest. Like I said, I got through school in zone 3, and then taking my breaks into zone 4, and I didn't go through school well. I procrastinated. I pulled all-nighters. I went on, that high sort of zone 3 dysregulated situation, and I was able to be successful, but um, in terms of other things, I find that keeping everything, sort of a regular practice of health and wellness is really important. So it's not just necessarily the mindfulness; it's about eating properly, right? Nourishing your body in a way that is also emotionally nourishing, but also good physically. One of the things that I used to fall into when I'd fall into the 4 was like, okay, let's binge on nachos, let's binge on ice cream, let's, like all that kind of thing, which has a very negative long-term outcome. So think about eating well, think about staying active, and it's tough when you have anxiety. If you have a significant amount of generalized anxiety or socialized anxiety, it's very difficult even to think about getting out of the house, that you might run into somebody, right? Or you go to the gym and you might run into somebody. Or for me, a lot, it was the expectations. I always felt like the eyes were on me, and I expected something of myself to be able to perform in a certain way. And if I didn't live up to that, right, that was my fear, right? So that's the anxiety for me. So um, I think it's a well-rounded approach, that if you can keep yourself mentally well and physically well through some of these other practices, that's the best situation. But let's face it, sometimes it's just a matter of struggling, and recognizing that that is part of the process, and it's okay to have days and situations where you do struggle, because that's just part of this whole anxiety thing that I've discovered. So, find what works for you, but whether it's meditation or not, mentally, but think about the physical side too.
All right. And one last question. Um, and this is a personal question just because I find you very interesting. So, some of us may experience trauma in our professions on a regular basis. I know some colleges that are attending this talk more than others. But is there a way that we can make these traumas less taxing, especially if we are experiencing them on a regular basis, so that we can stay more in that neutral area of our nervous systems? Or, yeah, I guess that's my question.
Okay, yeah, sounds good. Yeah, it's a very, very good point, that these, it's not necessarily a one-time trauma, right? You might see this a lot. I'm actually gonna not directly answer that, because I actually feel that it's a bit outside of my expertise. It's outside of my scope. I would say that what I've read from the research in that area, I've read the research in meditation and mindfulness, and overcoming trauma and trauma stress related responses. And I do know that there can be some very positive impacts that can happen with meditation and mindfulness practices. But having said that, everybody is going to respond to trauma differently. I am going to defer, and I would suggest that you speak with a social worker or a counselor or a psychotherapist, or someone that's a little bit more versed in that area, and has that specific expertise. I'm a little worried. I get a little worried, and this is part of my training that I got. When you start getting into situations where it's like a regular traumatic type situation, because there's a lot of negative that can happen with that. And if you think that mindfulness is the only thing and it's going to fix everything related to trauma, it's the wrong approach, because it's not going to fix it's not going to fix anything. It's going to help cope with a lot of things, but often it's with some people, but maybe in not others. And it may be in certain situations that it helps, and in others that it doesn't. And so, in those cases, I would suggest, seeing how you do. Like, I would absolutely try adopting a meditation and or mindfulness type practice and see if that helps you. But you may need more intensive help than that, and that's where those professionals in those areas would be better for you.
All right, that was awesome. So, before I let you guys go, I would like those of you who are attending live, to please go to IPECT and indicate in the discussion questions that you attended the talk live. It will just make it easier for us to keep track of who's attending live and who is not. And so that kind of concludes our sessions. I want to thank Dr. Butcher again for the presentation, and all the students who attended the talk live or are going to watch this on their own time. So thank you all, stay safe, and have a great rest of your day.
Thanks, guys.